session is going to follow a similar format. Over the next half an hour, Mary's going to be answering your questions on foot care and related questions. And some of you have submitted questions ahead of time, and I will read those questions out and Mary will answer them. After we're done with the pre-submitted questions, we'll of course open the floor up to questions you have in real time. I want to remind everyone that the session is being audio taped, and the reason we do that is because there are some folks who can't make it to the session, so they want to hear it afterwards, and we go ahead and post it onto our website so people can access it even though they're not available to attend at 6 o'clock. We've got a couple rules. To make sure that the session runs smoothly, we have two kind of ground rules. One is only one person talks at a time, so please be respectful and don't interrupt. Two, if the discussion associated with a certain question is going a little bit longer, then I'll give you a little signal and we'll close up that conversation. So originally from Newfoundland, Mary has been a nurse for 34 years. She's like a jack of all trades when it comes to diabetes care. She's a certified diabetes educator. She's a certified insulin pump trainer. So those of you who are on an insulin pump, again, feel free to ask questions, not just, specific to foot care. And she also runs her own foot care business alongside working at the Penticton Diabetes Center. She was diagnosed herself at the young age of 13. She has two healthy boys who are 26 and 28. One is a nurse and the other is an engineer. When she's not busy working at the Diabetes Center or running her foot care business, Mary loves to go hiking, running, and traveling. She went to Peru last year and hiked in Machu Picchu and ran Victoria's half marathon last fall. So, Mary, I'd love to, if you'd like to introduce yourself, say a few words before I start the questions.
Yeah, that's, thank you for having me. I think this is a great opportunity, this a great, I'm gonna call it a huddle, whatever you guys want to call it, for type 1s. Obviously I'm passionate because I have type 1 myself, but I think just doing the virtual opportunity like this, I think it's an awesome way to go. So yeah, I don't have too much more to say. I'm in my office right now. I actually worked all day, went home, did like 30 things, and then came right back. My home is too busy, so I thought less distractions when I'm back here to do this.
Great, so I'll start with question number 1, and it's anonymous, from an anonymous source.
Okay.
I had a tingling sensation in my heel after an episode of severe hypos. It lasts for about half a day or so. Should I be concerned?
So that's an interesting question. I would say, yeah, anytime any kind of tingling lasts longer, like ongoing, that is a concern. I mean, any time you have a low blood sugar, usually the symptoms will resolve itself once the low blood sugar comes up. But for if it doesn't, you're saying a day or so, whoever submitted this, I would be concerned. The only thing I thought about with this question is are you having maybe intermittent lows? You think that the tingling is going on all day long, but maybe you're dropping lots through the day, so the symptom kind of comes back or not? You know what I mean? You can sort of intermittent low blood sugars. So I would be concerned if your symptom of a low blood sugar was continuous after the low blood sugar was resolved. So I don't know if that person is having a lot of low blood sugars that day and they think that the symptom is continuing because of the low blood sugar, or if it's a nerve thing that's happening. So
okay, so the person who asked that question, if you're on Zoom, Charlotte, go ahead, please follow up and provide the details.
Yeah.
It doesn't always happen. It doesn't happen with every episode of low blood sugars. It's usually when I think after my periods, when my ratios, insulin absorption changes and my sensitivity increases, I see myself going low multiple times during the day, like a day or two after my periods, till I adjust back to the routine.
Right.
And that's when I start feeling the tingling. It goes away. It doesn't stay throughout the month or so. It just is for those 1 or 2 days.
1 or 2 days.
It worries me a little bit.
It's annoying for sure. Well, especially if it's related to the lows, regardless of what your symptoms are of lows, when they're more continual. Right? Do you adjust your insulin or your basal rate or whatever you're on?
Yes,
Do a
I
temp
do.
basal or something. Some people
Mhm.
do wonky things with when they're having different certain times of the month or whatnot. Yeah,
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 yeah.
yeah.
Because we can get really weird symptoms for lows too, right? I used to get like numbness and tingling around my mouth sometimes. I never get that symptom anymore. I don't know where it went,
Oh,
but I get different symptoms now, right? So
okay. Should I be talking? Like I did bring it up with my endocrinologist, and he mentioned that I don't have to worry too much about it.
no, I think that the more, it's a symptom that you're having right now as part of a low, but I mean,
Okay.
yeah, it doesn't sound like so you just need to be, to me, try and prevent or the severity or the frequency of the low versus, yeah.
Makes sense. Okay.
There's
Thank you.
101 symptoms of lows, right? That
Yeah.
the ones that nobody knows about except you or whatever, your own personal ones. So yeah, anyway, there you go.
Great. Question number 2, also from an anonymous source. When I was first diagnosed as type 1, I was experiencing quote unquote pins and needles constantly in my toes. Over the first few months of using insulin and getting my blood sugar under control, these feelings have completely subsided. This is something that my endocrinologist says is common and named neuritis. Do you think this might mean I have a higher disposition to having problems with neuropathy further down the road?
I mean, the risk of having neuropathy, I think neuropathy, nerve damage, right, caused by elevated blood sugars over long periods of time. Like, you know, you just a couple of highs every now and then is not going to do you in for neuropathy, but it's long-term high blood sugars that eventually damage the blood vessels. So what's going to have you a higher disposition for neuropathy is just poor diabetes control, period, right? Over extended periods of time. And the higher the blood sugars and the longer they are, the more nerve damage it's going to cause. So you said neuritis, right? Yeah.
Right.
Yeah,
That's
that's
just
right.
an inflammation of the nerves, right? So anytime there's an inflammation and whatnot, I mean, that can cause different sort of signals to your body too, with the numbness and tingling and whatnot. So one of the best things you just said, or what is that once your blood sugars became under, you know, better control with insulin or whatever other means you use to try and get your blood sugars down, that the symptoms sometimes they subsided. Is that what that was? Completely subsided? Yeah, they
Yeah,
could completely
they've completely
subsided.
disappeared. Yeah.
Yeah, so that's so cool, right? It's like, yeah. So that to me is that's a positive thing. I don't think you have any. I mean, I think the bottom rule is if you have diabetes, type 1 or type 2, particularly type 1, probably you're more at risk of having neuropathy, period. I almost think even if you have decent control, your blood sugars are never in that normal range, ever, right? They're normal, but they're never as good as a person that doesn't have diabetes. So we're all at risk for neuropathy. I know I hate to be the bearer of bad news,
No, that's okay. Yeah,
but
I was just really interested in this association between having this problem with what the endocrinologists call the neuritis, and then the
right, yeah.
potential predisposition to being like worse off or something down the line.
Yeah, it's another thing you got to deal with, right? If it's a neuritis and with the diabetes, if you have neuropathy or whatnot, because you don't have to have diabetes to have neuritis, and you can get neuropathy from different reasons too.
All right, great. Thank you very much.
Yep.
Great, thanks, Roy. Then the third question is from Marina. Is loss of sensitivity reversible?
What do you guys think? I would say
No.
it can diminish over time, but it never completely, you never totally regain the nerves don't regain that sheath that kind of covers them. That's what the high blood sugars do. They damage the nerves, the small nerves that go to well, all over your body, but particularly with your feet we're talking about. So it can be like we just talked a few minutes ago, it can be less. So the last question is, like you said, if your blood sugars are high, if your blood sugars are in better control, you don't get the numbness and tingling as much. So doesn't mean it's gone out the door and left and we'll never have it again. It's just that it's not as prevalent. Does that make sense? So it's kind of not, it's like a lot of the things that happen with diabetes, unfortunately, they're not reversible. Once the damage is done, a lot of it, what the goal is to prevent the progression.
Okay.
Yeah.
Thank you.
Maria?
May I
Yes, please.
ask if, well, it was worse. Now I feel less pain and less symptoms. So I wonder if I should be worried that I'm not aware of the pain, or maybe it was kind of an improvement. So
Yeah.
does any improvement happen in the symptoms of like?
I would say yes. So if your blood sugar control improves, then your symptoms will be less.
Okay.
Yeah, does that make sense? And
Yes.
on that point, you know, like, you know, what you feel is what you feel or what you don't feel is not necessarily what's happening, right? Because we all
Sure.
know that it's like yeah, it's like driving down the road and hoping that you can see at the windshield and you're doing okay, but it starts raining and you can't, you know, sometimes you don't have complete control of what you're seeing or feeling. So you got to use your eyes to check your feet. Anyway, I rambled a bit there, but yeah.
Thank you. Thank
Yeah.
you.
Great. Question number 4 from an anonymous source. A podiatrist once told me that people with type 1 often have less fat on the bottoms of their toes and balls of their feet, which can sometimes cause soreness after walking or hiking. If true, what are suggestions to assist in cushioning that part of the foot?
Yeah. So guess what? Everybody loses a lot of fatty paddings on the bottom of their foot as we age. So whether you have diabetes or not, it's one of those things that that's what they're talking about. I don't know if the person can see that, but when I do foot care visits, I often see people with calluses and whatnot on the bottom of their feet. That we do, of all places to lose fat, folks, right? Like on the bottom of our foot. But that happens sort of with an aging process. You know, again, you can get pads that go on the bottom of your foot. I think I have one of the pads here to show you really quickly. It's like a metatarsal pad. They're made by, can you see that? I don't know which way I'm putting it. Integel. You can get them at the pharmacy. So they're like a bit of extra, like extra padding that you can put just so if you're losing feeling pressure on the bottom of your foot, you can get these little pads. They don't stick, they just go loosely around the toes, and they give you extra padding on the bottom of your foot if you're really finding that's an issue. Wearing shoes that I always say, don't wear the same shoes all the time. Doesn't mean we had to go out and buy 18 pairs of shoes, but when you wear a different pair of shoes, you put different pressure on your foot at different shoes sometimes. So that's kind of a good thing, right? It's kind of like, don't sit all day, get up and move around and move your butt, right? So same thing with your shoes. When you use or your feet, when you put different shoes on, it puts different pressure on there. There's one other thing I was going to say about that. Just really good padded shoes, right? Shoes that have decent padding. I always tell people, when you look at your shoes, don't look at them from the outside. Put your hand in the shoe, feel up on the bottom, feel down on the top, because what you see on the outside is not necessarily what's happening on the inside. And you can buy the $300 or $400 shoes that our Minister of Health, what's her name, Bonnie wears or whatever, and all the fancy shoes. The price is not as important as the quality of the shoes or the fit too. So.
Whoever asked that question, did you want to follow up? All right, next one. Question number 5 is from Teresa. I've had type 1 for 53 years with foot complications and found a United States shoe website that makes cheap shoes for diabetics with foot issues, but they don't deliver to Canada. Do you know of any stores or websites here? Any I've checked out just sell horribly ugly shoes.
Yeah. So I'd love to know which one you use for the US. I'll pass it on to some of my clients. I don't know of any ones that I would recommend. And I guess my thought about that is, when I was reading that, is also, I wouldn't buy shoes online, right? Because I want to be able to see them, feel them, you know, put my foot in them. But maybe you have a mold or something of your foot and know how to buy your shoe. But to me, it's just like, you're kind of taking a chance when you're buying it online. But I get it when you have other foot issues or bunions or something like that. It can be hard to find them. New Balance, I know this is like a name, it's a brand of shoes like Nike or whatever. They're the type of shoe that has the wider width and the deeper toe box. So, and they can have some pretty cool, I mean, they're obviously an athletic thing or a walking shoe, but they're not terribly dressy or anything, but they're the ones I recommend to a lot of people, just because I know they have different widths and depths, and they're made really well. So yeah, there you go.
Teresa, would you like to follow up?
Oh, sure. Yeah, no, that definitely answers. Yeah, I was thinking, I know you really do have to try them on that site in the States. I had surgery on my foot.
Yeah.
Grabbed the shoe, it was all kind of padded on the sides and the bottom, and they were kind of a cute shoe, so I was really tempted to order them, but I thought, okay, and it was actually called diabetic shoes.
Yeah.
But like you're saying, it's probably a bad idea.
Yeah. And anybody can put a name on a shoe and call it diabetic shoe. So
Yeah.
the one thing I say when you're buying your shoes, look at the return policy, right? So we've got a couple of cool foot or shoe stores in town. And you know, when you buy your shoes, if they can measure your foot, if they can outline your foot, you guys know how to outline your foot? You ever do that?
No.
Oh, can I quickly show you that? So like you take a piece of paper. Can you guys see that? And you stand on the piece of paper and you outline your foot with a pen just around the circumference. And then you take your shoe and you put it over the outline of your foot, and your shoe should fit like this, not squished in your shoe like that, right? Because you can see the different pressure areas of, yeah. So it's a really quick kind of no-brainer way to, granted you're going to bring a piece of paper into the shoe store. That back in the old days, people used to measure your foot. That's still a really good thing to do if you went into a shoe store and they were able to do that. So just an outline of your foot. If you're standing up, get your buddy or your partner to outline your foot right here with the pencil, just around the paper, and then take your shoe and put it over the paper, and hopefully the shoe should cover the whole outline of your foot without any pressure areas. If you come to Penticton, Fritz's shoe store. Fritz's is pretty good. So they have a policy, most shoe stores, is if you wear your shoes inside for a couple of days or a week, you should be able to return them. You know, you're paying upwards of 80, 100, 200 bucks or whatever for your shoes. You really can't tell when you in the store that first 20, 30 minutes, you fall in love with them, but is it really fitting, right? So that's something you need to tell them, and hopefully they agree with that. I don't know about the US. Were you able to return your shoes, or did they fit?
Yeah, I never did order them.
Oh, you didn't order them. Okay. Yeah. I just wouldn't actually. I just because it's such a 7 is a 7 is a 7. No, it's not, right? It's yeah. I mean, so yeah. New Balance. Try some New Balance.
Okay, and what was that store in Penticton?
Fritz's, Fritz. Fritz.
Oh, okay.
There you go.
Check it out. Thank you.
Yeah.
Great. Nikki, question number 6. Hi, Nikki. Is it true that it's not good to put lotion on your feet being a person with type 1? I've heard people state this and don't understand why.
Yeah. So there's 2 questions about cream. The other one was a little bit about cream. So I just, yeah, so definitely people actually with diabetes have drier skin, period. So we don't sweat as much. That's a little bit about the, like their neuropathy. So we have drier skin, and with drier skin, we're more at risk for problems with heels cracking, not to mention it's summer and everything else like that. So yes, you should use cream for sure. Yes, put lotion on your feet. The other thing, I might as well just talk about this. Put lotion all over your feet, but don't put lotion between your toes, right? Don't put, unless it's an antibiotic or something that you were told to use for athlete's foot or something like that. Don't put cream between your toes, because that's the same thing as keeping your toes really moist. And when your skin is moist, like sweaty feet, or let's say you hop out of the bathtub, or shower, you're late for work, you're zooming, and you don't dry well between your toes. If you did that constantly, wet skin eventually is more prone to breakdown. So whether you don't dry well, you have sweaty feet, or you put cream between your toes, it's going to break down. It's going to cause skin breakdown. So you do want to definitely put cream on your feet. Yeah. Keep it at the bedside table or by the remote by your TV. Then you're more prone to use it.
Yes. So that's what I heard, that you shouldn't put it between your toes. And I just didn't get it. Like I'm newly diabetic, but I always put cream between my toes, and I didn't understand why. So is the wet skin prone to break down only for diabetics, or is that in general?
Everybody.
Oh, so
everybody. Like, think about it. If you ever sat in the bathtub for too long and your skin gets really soft and wrinkly, it's the same thing. If you left big blobs of cream. So, I mean, I guess the thing is, if you put cream between your toes, make sure you really rub it in well, and don't leave big lots of it or whatever. But then
that's not for diabetics, that's for everyone.
For everybody, yeah, everybody. But people with diabetes tend to have drier skin.
And is that in general if they don't manage it, or just even if you manage it?
I just think, well, think about it. Our blood sugars are elevated, and when your blood sugars are elevated, sometimes you have to pee more, like that.
Yeah.
But obviously, also with the autonomic, the nervous system, sometimes our skin doesn't sweat as much. Doesn't mean on a hot day you're not going to sweat, but just in general, we don't have that. We tend to have drier skin for that reason. Yeah.
Okay, that's great. Thank you so
you're
much.
welcome. Yeah.
I think Dave had a follow-up about socks. Dave, did you want to ask about socks? I saw that on the chat box.
Yeah, you go into the pharmacy and you see the diabetic socks hanging off a rack. I guess they're compression socks. Are they recommended? Do you recommend them? What do you think?
Like, unless you have poor circulation or blood that's, your swollen feet, or the doctor says you need to wear support socks, you don't need to wear support, like fancy stuff. So here's a diabetic sock. I just happen to have one hanging around. So they're big, they're expensive and all that, but the reason they're promoted is because they have, there's no seams. I know you can't see it from here, but there's no seams. They're nice and loose. When you take off your sock, regardless if it's a diabetic sock or not, you don't want to see big marks around your ankle, right? Because that's like cutting off the circulation. You might as well stick an elastic band or something around your legs. The same idea. So when you have a mark when you take your socks off, that means the sock is too tight. So to answer your question, you can spend as much money as you want on your socks. I don't think you need to buy the fancy ones. You just need to be aware a sock should not be too tight. It should be breathable. That type of stuff. Yeah, it doesn't have to be. You try. They talk about what socks are made of. This cotton versus synthetic, right? Something that's more breathable is obviously better. In the old days, I guess they're still, I was reading some of the other stuff, they still promote white socks, so that if you have something oozing or bleeding in your foot, you're going to see the blood more. Like, I'm like, oh, okay, I don't know. I don't wear white socks. I like to wear dark socks because it just looks better with what I wear, right? But if it, in the big picture, you need to get socks, just like your shoe fits, your socks should fit too.
Thank you.
Yeah, another tip really quickly? If you have socks that are too tight, I tell people to just cut a little slit down the back. I'm really frugal, and I don't like throwing stuff out if you don't have to, but if your sock is too tight, don't cut here, just cut a little slit in the back of the sock, and it just opens it up a tiny bit and nobody knows the difference.
Great. All right, question number 7 from an anonymous source, and still along the feet domain. I have really dry skin on my feet. What treatment would you recommend? So I guess what creams or whatever.
Yeah. So I often ask people when I go to do foot care, do you have any cream? Yeah, bring it out, show it to me. And I always say, okay, use it. The best cream is the one that you use. Often people will buy cream and they put it on for a couple of nights and then they just don't do it anymore. So the trick is to use your cream every night, just like when you brush your teeth, put your cream on. If you have super dry skin, it's, get a cream that has urea in it, UREA. It's one of the main ingredients. So, when we look at our food ingredients, and the first ingredient is the most abundant. With foot care creams, you want to get something with urea or lanolin in it. So urea is a really good product to be on the list of ingredients for a foot care cream at the beginning of the list. Where is my big picture? Someone else just mentioned this. Oh yeah, this is just a picture I have at work. But the Attractane, I don't have shares in Attractane or anything like that company, but Attractane has, where's the, yeah, that's what it looks like. It's got 10 and 20% urea. So you can get, different strengths, and you can usually get it at the pharmacies. But that's not the only one. It's just like you could pick the Walmart brand of cream if you wanted to, but look at the ingredients. Try and stay away from stuff that's super smelly, because the smelly stuff is perfume, and perfume dries out your skin. So just don't use smelly stuff.
It's called fragrant.
Fragrant, yeah. But there's the fragrance, okay. Like, and then, people will say, oh, they've got this lovely Avon stuff and it works great. I'm like, fine, use it. But what I find is people will get cream, they'll put it on Mondays and maybe one other day of the week, and they say, well, it doesn't work. Well, you need to use it every day nothing works overnight, right? There's no instant cream, but they do work when you use them. Like I've totally seen it, and yeah. So yeah, and so like 10 or 12 bucks for a tube of something. You can get German-made creams that are way more expensive. They work lovely too, but you don't have to pay that high a price if you don't want to. It's the ingredients that you got to look for.
Great. The next question is, again, very similar, but I like to read it anyways because I want to make sure everyone knows that their questions are being asked. As a long-term type 1, I'm always looking for a better foot cream for daily use. Currently, I juggle between Train,
yeah,
showed, and FootLogic's foam. And last but not least, if there is nothing else, I use Amino Skin Relief Moisturizing Lotion. My skin on my toes and bottom heels and edges is very dry and callousy. I also wear compression stockings every day. I would be interested in any information and knowledge concerning foot creams, lotions, etc. So do you feel like you answered that, Mary?
I sort of did, yeah. The only thing I would say, the frequency that you're using them. Maybe if you're doing it once a day, you could try twice a day just to see if that helps. I know this is not part of the question, but I think if you're safe and you are comfortable, you could use a very fine grit pumice on the back, if it's just on the back of your heels, if you're comfortable seeing and doing with that, because sometimes that will get sloughed off the dry skin. So we're not cutting or paring. It's just, what I'm talking about, like a pumice thing. Yeah, don't go right to town and work up a sweat doing it. Just gently put that on. That sometimes helps the cream work a little bit better. Another really good tip about the urea cream I forgot to mention, the best time to put that cream on, the Attractane cream, is after you get out of the shower. So it actually is dual purpose. It actually it helps slough off some of the dry skin cells, that the urea-based products, and it actually locks in moisture. So it does two things. So if you can, put it on after you get out of, after bathing. It will work better. Not to say you have to do it that way, but you might get more bang for your buck.
Okay, question number 9 from an anonymous source. I would like to know about pedicures. Where can I get a safe pedicure where there is education and advanced precautions?
Yeah, so in Penticton and whatnot, we have a list of people that are, I'm going to say, like podiatrists, foot care nurses. We don't have, and on that list is not the salons or the people that paint your nails, the beauticians and whatnot. Nothing against painted nails, they're all lovely, but the people in the salons are not educated around no, you know, blood thinners, diabetes. They don't know how to see an infection or not. They just, and right now with all the, I mean, just in terms of professional cleaning, sterilization and whatnot, you need to make sure that the person coming or where you're going to is taking all these precautions in terms of cleanliness and their tools and everything else like that. You can ask about their certification too. Are they certified to do diabetes foot care? Because, and what I would say to them is, are you comfortable doing foot care on a person that has diabetes? Ask them that question. I'm like, oh, well, I don't know. What's the difference? I don't know. And if they say that, don't go. And if they say, oh yeah, sure, no problem. I totally understand the effects of diabetes on, you know, that type of thing. You could kind of, you can ask just as many questions as the other person. But we don't typically recommend going to salons, but maybe in some of the salons in the big city, there's people that are more qualified than others, right? Yeah, so.
Anonymous, would you like to follow up? Any questions related to here? So go ahead.
I just want to ask, I mean, that is exactly my concern, that it's the cuticle and all of the drier skin that I want to deal with in it, but I'm terrified to go to the spa. So podiatrists don't do that, right? I don't care about the nail polish. It's about the cuticle and all of that.
So the podiatrists do a quick, they do very quick, and they deal with the problem. They probably don't even file your nails or whatnot. So if you'd probably prefer a nurse, like a foot care nurse. You get what I'm saying? Yeah. So I don't know where you live. Do you have foot care nurses in your town?
I have no idea. Never heard of one. Vancouver, but
there's tons.
Would I find one at a podiatrist's office? They might have a foot care nurse.
You could phone the podiatrist, or you could just Google foot care nurse. Do you have a diabetes clinic? Go to a diabetes clinic. Yeah, ask the nurse or the dietitians there. They should have a list of local foot care resources that they're not going to say, oh, this one is better than that one. They'll say these are the ones that we know are safe to go to. I don't know, but yeah. And then you do your research. So when you phone them, well, you know, like, are you comfortable doing people with diabetes? Or I have a callus, and how many people, and how long is your visit? You do your you know, you're choosing who you want to. Podiatrists will be 7 minutes. No offense, if there's any podiatrists on here. They're really good. They do what they want. They're not going to put cream on your feet. They're not going to file.
What does a podiatrist do then? Just examine?
He's a doctor. He's a physician that has I don't know, 6-7 years of medical school. They also do surgeries. Right, podiatrists are doctors that will do surgeries, they'll do assessments, they'll do whatever, but they also do basic nail cutting. Or if you had a huge honking callus, they'll pare it off with a blade and done. Whereas a nurse will pare it gently, and we'll be nice, and we'll file, and we'll talk to you about your cream and assess your shoes and do blah, 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 you know? So
So would you recommend, do you recommend like a diabetic to go to a podiatrist once a year, or?
Yeah, I think it wouldn't hurt to get your feet assessed by that. Okay, here's another little thing. Your family physicians, God knows they're not doing it, but they should be, is doing at your annual visit, they should be doing a foot check, or your diabetes. Well, you could go to the diabetes clinic, and again, just in Penticton, not that we're the best. Once a year we'll do a foot check, and we'll note when we did it, and that's checking your pulse. We'll feel with a monofilament in the back of your foot. We'll look at your shoes. I look how you walk, and blah blah. It's that we make an appointment just to do that, because we know it's worth its time and gold to do that, to prevent.
Where's
problems. It's right here, right at the diabetes clinic in Penticton. The nurses and the dietitians, as part of our once a year check-in, Probably doesn't happen quite that often, but we, you know, yeah, we do that. So that if you ask the nurses at your local diabetes clinic, can someone do a foot check on me? They should be able to do that. There's a list of things they're supposed to check for. That being said, your family doctor should also do that. It's like we go for our annual PAPs back in the day or something. If they know you're coming in to get your feet checked, you don't have to have your toe fallen off to get your feet checked. They should just be doing it to prevent problems, right?
Okay, thank you.
Yeah.
Great information.
Yeah.
Great.
Yeah.
4 questions that have been asked in the past 3 minutes. So first one is Dave. Did you want to ask your question? Do you remember your question, Dave?
Yeah, it just this has nothing to do with my feet. My feet seem to be fine, but I'm getting tingling and a bit of pain and numbness and pins and needles from my shoulder down to my right wrist fingers, multiple times a day, lasting for a few minutes. Is this diabetes or is it my screwed up shoulder?
I'd say it's your screwed up shoulder. Do you have a frozen shoulder? Do you have any like?
Yep, both sides.
Yeah, yeah, that's it. Yeah. Well, I mean, diabetics are more prone to frozen shoulder syndrome.
Yes, and
it lasts a couple of years, or yeah.
If you get it on one side, it's something like 80%. You'll get it on the other side.
Yeah, I know. Yeah,
anyway,
tell me about it.
Confirmed.
Yeah.
Thank you.
You're welcome.
Okay, we've got a lot of questions, so I'm going to extend this time because I know we said it was 6 to 6:30, but I think it's important to make sure you guys get your questions answered. So the next one was Nadia. Nadia, did you have a question about the orthotics, if you're here?
Yeah, I was just, I've been to the podiatrist before because I had numbness and tingling in my toes, but it was because of wearing ski boots and hiking boots. So he prescribed getting, and then I went to podiatrist and I got orthotics, and that kind of like helped. I'm just wondering if that's like for an idea for other folks too, in terms of helping them and what you think about custom orthotics, or even the ones that you buy in the store.
Well, I think that's good. I think, yeah, orthotics are good. But the starting point, though, don't everybody run out now to Shoppers Drug Mart and buy orthotics or something, is get your foot assessed. Get it assessed first, and then you can decide. Because sometimes you don't have a problem, but we can assess that you're going to have a problem if you don't do something about it. For example, we talked about the decreased, you know, padding on the bottoms of our feet or whatnot. And sometimes I can look at someone's foot and say, oh, I can see pressure areas. And they're like, oh, really? I don't feel a thing. And it's like, oh, okay, well, but if we don't address the pressure areas, maybe with a little, you know, it doesn't have to be an expensive orthotic or padding, then yeah. So the first step is just to get an assessment. But you, obviously it helped you, right?
Yeah, well, mine was, I was just really concerned about the numbness and tingling because that's kind of the question that they always ask. I was like, yeah. No, I lose my toenails in ski boots.
Right. Yeah. Yeah.
So I really know that that's bad as a diabetic. So what do I do? And so they did do a nerve conduction test too, which was like helpful. So then I at least had like a baseline and I had no net loss, but you know. Yeah. And then they did the same thing too in my hands. I don't know if that'd help you, Dave.
So yours was due to trauma from activity, injury.
Yeah.
Like, yeah. So that's the difference. But either way, the trauma is not good when you have diabetes, right? So it's
exactly. And then like losing my toenails and potential for infection and all that kind of stuff, I was definitely trying to figure out how to solve that problem, and the customer helped. Yeah.
So definitely getting someone to do the proper assessment. And that's where a podiatrist would be probably the first step or whatever.
Brought in all my hiking boots and ski boots and walking shoes and that stuff, and they made sure that they fit into all of them and that stuff. So
the other good resource, which I should have really thought about, that we're just talking, podiatrists do the hands-on stuff, but if you want to get a good assessment, some of the physio clinics will do that also. They'll look at your gait. You can go into a physio clinic and they'll assess. Yeah, and that's what some of our clinics here will do, orthotics at physio clinics and stuff. That's different all over the province, right? But yeah, it's great.
Yeah, I had to go to Calgary for it. So I mean, I went to Calgary to get a good podiatrist.
Yeah, good.
We have a question from Teresa about coverage and foot care nurses. Teresa, did you want to chime in?
I hadn't heard of a foot care nurse. So are they actually at the diabetic clinics or?
No, most of them worked out of their own like clinic, they have a little, you know, they have an office or something like that, or they do home visits. I focus on home visits because I don't have space or time for my own clinic. But yeah. And so a lot of them just, did you ask about cost too? Who was asking?
Yeah, just because, you know, a podiatrist, I've been to some and they're very expensive.
Yeah, so depending on what your income is, there's always a user fee to go to a podiatrist, and then sometimes there's a much bigger fee to go to a podiatrist. So you're looking at a chunk of change, like, I don't know, like $75. But a lot of the extended health benefits will give you so many visits a year. So I always tell people, before you do anything, check your coverage. And, you know, don't say, oh, I don't think I have it. I don't know. I don't, whatever. No, check your coverage. Because say, do I have any coverage for physio, or do I have any coverage for dental? Same with my feet. Because sometimes, you know, based on your risk factors, a higher risk factor for foot problems with diabetes, your plan will cover certain things like that. As a foot care nurse, I always give people a receipt, and I tell them keep it, and a lot of them don't. They need duplicates at the end of the year, because you can claim that on your medical at the end of the year. Your income tax stuff, yeah. And some people will just send it in with their like Blue Cross coverage or Great West Life or whatever.
Okay, and you guys charge a little bit less than a podiatrist?
Yeah, I mean, again, average like I charge $40. So I don't know what the big city is, but yeah, and that's per visit, so it's not per 18 minutes, or I mean, it's never 18 minutes, but you know what I mean. So yeah.
Oh, great. Okay.
Sometimes it's good just as a one-time assessment, and to get that reassurance, and if they make recommendations, and you can follow through with them, right? Yeah.
Right. Okay.
Yeah.
Great. Thank you.
Okay, we've got 2 pump-related questions, and the first one is from Alan. Alan, do you want to ask?
Yeah, I'm fairly new to the pump, been on it just a few months here. And one of the things I've found is the different places I put the infusion set, that I have significantly different requirements for either less or more for both the basal and the insulin to carb ratio. The nurse trainer that was helping me, she didn't think that should be as significant as what it is. And I'm just wondering if that's normal, and what would be some of the reasons for that.
So are you new to diabetes or new to pumping?
No, I've been on MDIs for 30 years before this.
Yeah. So do you think some of the places that, you know, again, do you know what lipo is?
Yeah.
So to me, I know for a fact that if your infusion set's in a place where there's more lipo, it's not going to get as much as good absorption. Then all of a sudden you go to a fresh spot, and look, things are just flying right by. Everything is, the other thing would be, you know, just to, I don't know what kind of pump you're on. It's a cannula kink. Is it not kink? Sometimes if you're doing a lot of bending and shoveling one day, it kinks more. You don't get a total occlusion, right? But you know, you're getting insulin, but you're not getting 100%, that type of thing. So yeah.
So different parts of the body shouldn't really matter then.
I think, well, in terms of absorption, we know that the belly insulin's absorbed quicker in the belly for sure. That's been like that forever. But hey, you can't put your set or your pod or whatever there you know, you got to move it around. Yeah, exactly. Yeah. Do you use a sensor?
Yes, I do.
Yeah. Does it ever Dexcom or
Dexcom? Yeah.
Yeah. So I mean, you know, those beeps, those alerts are great, right? Yeah.
They're great, but also a bit annoying.
Annoying. Yeah. Maybe you have them too tight. Maybe you have them, Yeah.
Okay. Thank you.
Great. Nikki, you had a couple pump questions.
Okay. Hey, thank you. Yes, so I've been on the Omnipod for 3 months now, and I'm coming up on 1 year being a diabetic. And my question is, how much time before can I use the same site again? Like, how much time do I have to wait ideally? I find that the stomach is the best spot for me that works. And it doesn't hurt me when I sleep, blah, blah, blah. It's just, it works for me the best, but I'm switching it. When I switch it, it's every 3 days, and I'm switching it maybe like an inch down.
Yeah. So do you know what I teach people to do is when you take off, before, put your new infusion set should be like in the same area but just a different location. So exhaust your whole one side of your belly, like boop 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 boop, with your infusion sets, go all around. Then go to this side and boop 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 boop, like 4 or 5 sets. Then go to your back of your butt. So by the time you come back around to here, it'll have a good rest.
Okay, so that's kind of what I'm doing, and I don't need to. Can it just be like an inch between the insertions?
I always say a pod distance apart. So if that's a good rule of thumb, right?
Okay, perfect.
Yeah.
Thank you. And one last question: what is the difference between having a super hot bath for like 10 to 15 minutes with your pod and going in a hot tub for like 10 minutes?
Yeah,
not long, but
so I think hot tubs are hotter, and it's not so much the pod, but insulin doesn't do well when it gets really hot.
So should you not even be having a hot bath with the pod on?
No, you can have a hot bath, because I'm like, a hot bath is never quite as hot as a hot tub. If I was lucky enough to have a hot tub, or if I go to a spa, I always tell people, if you can plan it, put your pod on the back of your arm so you can kind of do this thing, and then you got your wine in your other hand, right?
Okay, so it's not safe to go in even for 10 minutes, like if you were to time it or something in a hot tub?
I mean, I think probably 10 minutes would be okay. The manufacturers say that it's the insulin that's getting hot, right?
Yeah.
The insulin is getting hot. So that's the issue with being long-term in a hot tub. You know what? You only live once. Go in the hot tub for 10 minutes. See what happens. Monitor your blood.
It hasn't happened yet, but
I don't know. Maybe you can take that off the recording or something. But but they have to cover their butts too. The manufacturers do, right? And they, store insulin between this temperature and that temperature. Yeah. Well, we all kind of push the limits with life and stuff like that with diabetes. Just be careful. So especially if you are going to go in the hot tub, maybe that's the time that you want to change your pod when you get out or something like that.
Yes. Really quick, can I wear the pod on my calf?
Your not calf, upper leg, not
my calf.
No, it's
it's too muscly.
Yeah. It just you need the. Yeah, I know there's people that have tried it and the absorption is not good, and it's just it's not.
I tried it and the absorption worked really good and it was fine, but I don't know if I'm not supposed to do that.
Yeah, phone the pump company.
Okay, yeah, they'll probably.
I know the legs. I've even heard people using and again, everybody's got a different body physique too, right?
Yeah.
So I've heard people using stuff they've got thicker backs and putting pods in their upper back, not their lower, but it's like, okay, I mean, that wouldn't work for me, but lots of people. Yeah.
No, that's great. Thank you so much.
Yeah.
Thank you.
Yeah.
Okay, again, I know it's 6:52, but it seems like people have a lot of questions, so I'm just going to continue on with the questions. Lauren, you had a question about drop foot?
I feel like that's a massive one. I can hold it for another day. That's all good.
Okay, Ashley, Shade, you had a question? You're before Ashley? Shade, are you there?
Yeah, there I am.
Sorry.
Hi, I have a question. I have dropped arches, so flat feet. I was born like that, so I have orthotics, and I should have probably gone to a podiatrist to have it made, but I went to Kintek and had it made. And I'm just wondering, I would like to see a podiatrist. Can I wear those padded things that she was talking about with my orthotics?
So the thing about wearing, you should be, the one that I showed you a picture of?
Yeah, the one that you showed us in the past.
Yeah, that doesn't take up very much room in the shoes, not that thick. So the big thing you have to remember is when you're adding an orthotic or padding, that it fits into your shoe, so it doesn't make your foot, rub up against the shoe or whatnot. So if you need it, yes, but to me, you should assess to see if you even need it. Obviously, you need the orthotics for your drop foot if that's something lifelong, but yeah.
Lifelong, and I need the orthotics, but I have calluses right the hole at the bottom of my foot.
Right, so that needs to be assessed more, and a podiatrist would be very good he could probably even give you something, it's too much to go into on this, but yeah, there's lots of things that he could do. So I would say that versus the ones that I said with the Indigel things, I would definitely spend the $50 or less at the podiatrist. Yeah.
Yeah, no, I'm going to, and I didn't know about the foot care nurse also, so I'm going to do that as well, just for the future. And I do have New Balance shoes, by the way. I had to get for my orthotics because they are wider.
Yeah.
And so I just wanted to mention
that.
that.
Huge with, and there's some really colorful ones out there and cool ones and all that. So
yeah.
If you order, if you know New Balance and you know the number, the model that you like, then I would say, forget the lady that asked that question, but then I would say if you know that model and that make, then you could order from the US or order whatever, because sometimes they have way more stuff online if you know the actual model and everything like that. So that would be a bit different than just ordering just because,
Thank you.
Yeah.
Ashley Russell. Hi, Ashley.
Hi. Can you hear me?
Yes, we can.
Okay, perfect. Okay, so I'm like a newly diagnosed diabetic, and I have this like blister on my foot, and I'm pretty sure it was because I was wearing wet shoes and I was out hiking for too long than I should have been. But anyway, I've got this blister, and it's like between my toes and like the bottom part of my foot. And I'm just a little concerned about it, and I don't really know what to do or how to handle it. And I went to the pharmacy today, and the girl kind of just like looked at me like I was like on crack or something. And she was like, "Why are you so concerned about a blister on your foot?" And so I just wanted to know like how to go about handling it, because like normally when I get them I would just pop them, but now that I'm diabetic, that's not probably the best way of doing it.
So don't pop it. Blisters will, the fluid in the blister will hopefully just, I mean, if it pops on its own, that's fine. But it, because it's caused by friction, and probably we know the reason that it happened. So that's kind of a good thing, right? So next time don't get your feet wet and bring extra pairs of socks. I don't know. But right now you just had to watch for signs of infection, redness, oozing, ooey gooey, hot, that type of thing. And a blister should probably just, as it breaks or whatnot, the skin will get kind of loose. It's like a balloon that's deflated sort of thing. That's what the skin will look like. And then it will just kind of dry up. So I wouldn't run off to the doctor right away. You just need to keep an eye on that, each day and make sure that it does not look infected.
Okay, is there any suggestions on like how to make like walking a little bit easier? Like I'm trying to stay off it as much as I can, but it's not always possible.
Yeah, it's a tough one, right? Because the blister is right between your toes, right? That's a tough place to have a blister for anybody. Okay. Is it like a few days now that you had it? Like, is it?
Yeah, it's going on about a week now.
Oh, is it getting bigger?
It kind of like has a mind of its own. Like the other day it was kind of really blowing up and like almost like was gonna burst if I stepped on it, but then like it kind of went down.
Yeah, it sounds big. You know what, in that case, I thought it was just like a day or so ago. You again, I don't know if you can even see a doctor these days, right? Because you don't want it to be infected, right?
Okay.
Yeah. How do you feel about going to see a doctor or walk-in clinic? Do you have any polysporin at home?
Yes. Yeah, I'm pretty sure.
Yeah. You could start putting a little dab of that just around it. So this is a time when you would put something between your toes, folks, right?
Okay.
Like something like the cream or medication or something like that.
Okay.
Yeah. You, I mean, it is going to break at some point, but if you keep walking and it's causing friction, then it's not going to get better. Is your job walking and stuff? Like, do you have to?
Yeah, like I clean houses.
Yeah. It's a tough, I would say you probably should get it checked if it's been there a week.
Okay.
It's not looking any better. Yeah.
Okay, cool. Thank you very much.
Yeah.
Okay, great. Before we thank Mary, you guys don't know this, but your name, I mean, you guys were entered into a raffle by me. So I gave a talk for Diabetes Canada, and they usually give the speaker an honorarium, and I asked them if they could keep it, and they said that, that for some reason they're not allowed to keep it. So I asked them to just put it in gift certificates and I would raffle it off. So there are 4 $25 gift certificates to Walmart. I chose Walmart because everyone tells me that that's where you can get the least expensive diabetes supplies. So Monica, do you want to read off the names of the people who won the raffle?
Yeah, just give me one moment. So the names, there's 4 people that won. And they are, I'm just opening it up one second. Roy, Teresa Ring, Melanie Tabakman, sorry, I probably mispronounced that, and David Bola.
Okay, great. So you 4, after the session, I'm going to go ahead and forward you those Walmart gift cards, okay? Yay, you. All right, so Mary, thank you so much for taking an hour out to answer. I wasn't sure how popular Footcare would be. I think I knew it would be popular because people say it's always under talked about, and so obviously it sounds like it is. So really glad to have you on our team and excited having you come back to answer questions in the future.
For sure.
All right,
Okay.
great.
Okay, later.
So we're going to move on to our next section. We have 30 minutes to do the sharing your diagnosis stories. For those of you who attended last month in July, we had some really great stories, and you know, they're the kind of stories where, you know, Dave and Nadia, it really gave me a better insight into who you are. I mean, I know you, Dave, really well, but to hear your story really was a little bit heartbreaking, but it just made me feel like I knew you before. So we have several people who want to volunteer and share their story, and we probably have room for 4 people. So Sandra, if you're here, would you like to go ahead and start?
Hi.
Hi, Sandra.
Yeah, so I guess I was diagnosed about 4 years ago, and all of this took place in Alberta, so slightly different context. And I symptoms about a year before my diagnosis, and it was strange because I was seeking very regular medical care through my family doctor at the time, but she thought that I was such a weird case, I suppose, despite showing all of the typical symptoms. She actually kept saying that they didn't make sense because I don't have diabetes. And I'm not sure how she came to that conclusion, because when I look back through my records about a year before my diagnosis, and she ran some kind of random or fasting glucose test, not an A1C. And I definitely had a higher level of blood glucose, but it was it was just shy of when the lab would flag it. So it was just under 10, which I've now, through talking to people, would seem really unusual in an otherwise healthy and young person. So she kept insisting that I didn't have diabetes. And my symptoms was just progressively getting worse. And I think at the worst point, I was under 100 pounds. And I'm 5'4", which is, I looked like a skeleton. It was crazy. And I was thirsty all the time. I was peeing, all those usual symptoms. And it's just so strange thinking back to it, because again, accessing regular medical care, she was referring me to specialists left and right, because to treat those symptoms. So like frequent yeast infections, I was being sent to the gynecologist, and I was being sent to like these dental specialists because the inside of my mouth was like peeling. And I was also being sent to get ultrasounds because I was having stomach issues. But surprisingly, none of those individuals, and obviously they are focused on a special area, really connected the dots to say like, oh, we think maybe you have diabetes. until it got to a point where I was throwing up one day, and there was like blood, I guess, there, and I just like, I couldn't handle it anymore. So I went to the ER. And just for context, my work is in public health research. So I'm not one to readily go to the ER, because I've always been like, access your primary care system first and don't take up, you know, the emergencies time and such. But I just like, I couldn't handle it. So I went, and I guess spoiler alert to that is that I didn't get diagnosed then. So I went to the ER, and after waiting a long time and finally getting checked in, they took some blood, and was seen by this young resident who was very nice, but he, for some very odd reason, had kept questioning me on whether or not I was taking any substances. And I thought it was just really strange, because I think sitting there, I was thinking that I didn't even really fit the stereotype, if he was kind of going off of that road of thinking. But he kept insisting. He's like, oh, you know, even a small amount of weed could cause some serious side effects in some people. And I didn't really give anything in my history that would indicate I'd not used any illicit substances before, and so I'm not sure where that came from, but that's what I told him. And so he did run blood tests, and again, looking back through my records, I saw that when he ran he didn't do an A1C, but he did do like a random glucose test, and at the time it was like 17 or somewhere close to 20, but he missed it. So it did get flagged, but I don't know what happened there in his head, but it was missed. And so I was sent home from the ER with I think a prescription for like an antacid for the throwing up part. And then I went home, and it was essentially like at the point that I got home for the next 24 hours that I was just getting progressively worse. Like my memory of that was quite fuzzy, and I was experiencing that, I think it's called like Kussmaul breathing thing, where it was just like I was having trouble catching my breath. Luckily, my partner was there at my apartment with me, and I think I lasted about another 24 hours because I got sent home from the ER. So I just figure like, what's the point of going back, because they don't, there wasn't really anything that was wrong with me from what they said. So I just gave in and just told him like, can you please take me to the hospital again? This is too painful. And so we went, and luckily this time around, the attending physician who was there, he didn't even need to run any sort of tests, because all of a sudden he just came in and he just went like, oh, you have diabetes. And that just came as such a surprise, because literally every single physician and healthcare provider that I'd seen at that point kept insisting that I didn't have diabetes and I had maybe something else like a stomach ulcer or something. So so that was that was kind of like a relief, to be honest, to finally have an answer to all those symptoms, which, you know, then I learned were very typical. And that physician was very like surprised and very taken aback that the previous ER doc did not catch my abnormal test results. So then I was in the ICU and such, and spent a couple of days in hospital. The nice thing is, I guess, is that, and I'm still like to this day a little bit conflicted about how I feel about that physician's mistake, because he was actually there that day, that the second time that I went back to the ER. And I think that the second physician I had did tell him about me coming in and that he made a mistake. And he actually came to my hospital room one day and sat down and apologized to me, which at the time, because I was still like kind of just so tired from everything, that it just didn't really like register the significance of it. But he apologized, and I was told later that it's quite unusual, I suppose, like because of, I could have, I don't know, complained and against the college to him or something of that sort. And so, yeah, and I never, I didn't take any steps later after the fact. I got hooked up with a really good endocrinologist and diabetic team in Alberta. And this endocrinologist, he actually taught in the medical school that was the teaching hospital that I went to. So I think he actually knows or knew the ER physician. And he actually was so, I guess he was kind enough he told me that he went and had a very stern talking to with that physician. And he told me to rest assured that doctor will not be making a similar mistake in the future, at least when it comes to type 1 diabetes. But yeah, so I mean, I think after it all happened, it all worked out. And like I said, I'm just relieved to have a diagnosis. So, I mean, with all of that, I think I've been more skeptical of accessing care. And I'm more likely to question whether or not someone, like a healthcare provider, is knowledgeable about my type 1 diabetes. I've had, since then I've had some really excellent care. And then I've also, had some mediocre care where I'm sure everyone's experienced that kind of being attributed to type 2 or things like that. So yeah, so I think it's been a little bit interesting, I think, from my professional life as well, because I work in that area of public health, and it's kind of I've seen what the challenges as a patient, but then, and trying to kind of reconcile that with the kind of advocacy and I guess the professional message that goes out. And I mean, in a way it's been kind of helpful, but yeah, that's kind of how I got diagnosed. And I'm in Vancouver now, so I had been trying to set up all of my healthcare providers. It's not been as easy as it was when I was first diagnosed in Edmonton, but I'm slowly finding a family doctor, and I have an endocrinologist now, so that's good. I'll be looking out for a foot care nurse now.
So Sandra, thank you for your story. I'm not surprised you're still conflicted about it. I mean, the story just is unbelievable, but believable. I can't, because I have heard stories similar, but it sounds like for a year you were not diagnosed, and I'm glad it all ended up well. But as you're talking, I'm thinking, when it comes to healthcare, it's almost like the luck of a draw. So, your GP happened to be someone who's not very evidence-based, and okay, but then, you end up in the ER where someone knew exactly what you had. But the thing is, we shouldn't have to rely on we're just gonna luckily get a good one. And this is what I was talking about. Mary Tulk is just, we did these focus groups with all these patients in Interior, and it was just a lot of stories about horrible physicians, even diabetes educators. But anytime anyone talked about a good educator, it was Mary. So they'd be like, oh yeah, this woman, Mary Tulk, she has type 1. And I just kept thinking, oh my God, Mary, you're like this beloved person. And for you, Sandra, I feel bad that you didn't have Mary first, right? You didn't have someone like that, and you went through so much torture, almost died. So I'm glad that, you know, you're here, and I'm glad that you're still thinking about it. And I kind of have a feeling I know who your doctor was. Was it Peter Sr. at Alberta?
Yes.
I used to be his patient too. Sorry, I just
really?
oh, come on, it's gonna be Peter. That's awesome.
I was like, that must be Peter Sr. because he's a wonderful man, just a leader in diabetes around the world. And I'm so happy that he stood up for you and went to, because, you know, he's all about education as well. And part of it is, you know, what upsets me is that, like, we're trying to teach medical students and residents to be better at listening, yet still this is happening. So thank God there are people like Mary and Peter and Jerry out there. So thanks so much. Does anyone else want to ask Sandra any questions or make a comment? Please feel free to do so. And if you want to, just go in the chat box and then I can just call your name.
Yeah, sorry, I got too excited. I was just like, is it Peter Sr.? I wasn't too sure if it was okay to ask that, but yeah, Peter Sr. was one of my my endos as well, and he absolutely made it diabetes better for me. So, but I did move to Vancouver after that, and there's good endos there too. So, I'm sure you'll find a good one that fits well with you. That's like Peter.
I know, but no one quite like Peter. I feel like, or at least I haven't encountered one yet. He was just the most pleasant person to have an appointment with.
Yeah, he's a wonderful person. Lauren, you have a comment?
Yeah, I was shaking my head at everything that you were saying in terms kind of the unbelievable story. And also at the end where I think what stood out is just that I think a lot of us, or I feel like you become the expert of whatever kind of your care is moving forward. And so it just, yeah, that kind of hit me that you sound like you're going to be the expert. And that just resonated with me in terms of even when you have someone good, you still know the most. And I feel like sometimes the best providers are the ones that treat you and recognize that, yeah, you know yourself and you are the expert of this. So, yeah.
Yeah, and I think I've realized that there's really no shame in asking for a second opinion and just seeking other providers. I think that was the biggest thing that I felt like I couldn't question the medical advice that I was given. So,
well, you know, as someone in public health, it's your instinct to collect data. So all you're doing is collecting more data and evidence, right? So it's really not personal. You're asking for a second opinion. You're just asking for more data. So I don't think it's a personal thing. Great. Jerry, did you want to?
I have a saying in my house, question everything except your mother.
Okay, great. I'm going to have Lena Forend. Are you still here? Did you want to share your diagnosis story? Okay, June Lee, are you here?
Hi.
Hi, June.
Can you hear me? Okay. Okay, so my story is a little bit different from Sandra, actually. Well, I'm originally from Korea. So I got diagnosed in 1997. So that's like 23 years ago. So I was in middle school, and at that time, it was during winter time. And apparently I heard there's more cases found during winter time. Get diagnosed with diabetes. I don't know if that's true or not, but that's what I heard. But anyway, so I was drinking a lot of water. Like I drank like 1 liter of water bottle and then finish it. And then I realized, oh, I'm thirsty again. And then my friend was like, well, you just drank like 1 liter. And I'm like, no, I'm thirsty. So I thought something was kind of wrong. But I was always a healthy kid. So I'm like, no, it's fine. And then I was really, really tired. I always like, I'm tired, I need a nap. And I was going to washroom a lot, and I was eating a lot. But I was losing weight. And at that time, my mom was, she stayed at home. And so she realized that, oh, something was not right for me. So she took me to the hospital, and you know, I was a pretty healthy kid, so I was like freaked out when I had to go to the hospital. I'm like, no, nothing is wrong, you know, but like she dragged me, so I went to the hospital. And we went to the closest hospital near my house. She didn't really know about, you know, diabetes or anything. She didn't know, but so we just went to the nearest hospital, and then there like we did a bunch of testing, and they said I got diabetes. My fasting glucose level was 17 millimole, but doctor said, you know, you're lucky. You know, some people come to the emergency, you know, they pass out and then they come to the emergency, but you're lucky you walked, you know, with your legs. So, but I was so upset at that middle school kids. I was so upset. I still remember that time I was coming out from the doctor's office and my tear just coming down. Like, I didn't want to cry, but it's just naturally coming down. There were so many people waiting area, but I didn't care. I was just crying. And then I came home. My grandmother, paternal side, she actually passed away, but she had type 2 diabetes. And she lives a little bit far away from us. So whenever she come and visit us, she always stay with us. So, you know, she had diabetes for, I don't know, like 30 plus years. So she was well advanced, and even though she was type 2, she was taking medication, and also she had to inject multiple injection a day. So I kind of knew about diabetes, but not really. Like the reason why I was crying that time, because I realized that, oh, I can't have any sugar anymore. But actually, it was more than that. Later, I realized. But my main concern at that time was like, oh, I can't have this cookie, I can't have that, I can't have this, and you know, like I was very upset. And so in Korea, when people get diagnosed with diabetes, well, I guess my mom did some research, and she wanted to, she knew that it was type 1, or we call it at that time juvenile diabetes. So she wanted to go and seek healthcare who is doing, like, specialize in juvenile diabetes, which is type 1, I guess now we call it. And so it was far from my house, but you know, we drove there, and then the doctor said you have to be hospitalized. So that's very common, like when people first diagnose. Here, I don't think so here in Vancouver or in North America, but it's very common in Korea, because you know, they want you to be in a hospital, get educated, you know, understand how to do like injection. And I was asking them, like, do I have to do it, like even if I go home? And then they're like, yeah, you have to learn now. So, you know, like learning about injection, learning about counting the carb and all those things. So when I was first hospitalized, obviously I was kind of sick and stuff, but you know, at the end, when I was discharged, I was like, it was after, I think I stayed there for about a month. So, you know, like maybe like couple of days I was like lying and I'm like, I'm tired, but you know, once blood glucose is under control, I was fine. So I was going out and stuff. So and so yeah, and I did a lot of so I did exercise with my dad. They had some kind of small court in hospital. So because they tell you, you know, like you have like you need 3 triangle: diet, your insulin, and exercise. So those 3 has to be balanced. So my dad was like, okay, we have to be active, I guess. I was never active. Like I hated exercise, but diabetes really changed my life. And I think in a way that's kind of like a positive point for me, because if I wasn't diabetes, you know, I would probably like, okay, I don't care about my body. I mean, like, you know, like not exercising or, you know, and stuff. But diabetes kind of at the beginning, it kind of forced me to do exercise. But now I think I'm really thankful that, you know, like I think I'm healthier than like my normal friends, you know, who are more, you know, sedentary and stuff. So I'm very thankful because it opened up new opportunity for me in different way of life. Yeah, so my dad was like exercise coach, and my mom. So we in Korea, we follow a calorie system. So she has to measure rice because that's a stable food for us. We eat a lot of carb in Asia. So we bought like a weight scale, And so she measure rice, she measure like, you know, say we have protein like chicken or something, you know, she measured the chicken as well. And like, you know, veggie, you can eat whatever, you know, like you can eat as much as you can and stuff. So a lot of diet in my house also changed as well. So it kind of, it didn't just influence me, me being diabetic. It actually changed our like family, like, you know, like diet. And also so yeah, like my mom was like a cook, a chef, and then my sister, she has to kind of like, because I'm elder sister, but she sometimes don't get what she wants, because like, you know, like, you know, I was diabetic, and my mom always asks, okay, what do you want to eat, you know, like, and stuff. So little I'm sorry to say it to my sister, even though she's younger, but I kind of get like a special treatment. But my mom never like treat me as like special kid. Like she eats ice cream in front of me and then like I'm pretty disciplined in terms of my diet and stuff. Well, now like it's been like, you know, I've been living with diabetes for long, but I think my mom never treated me as a different kids, you know, like she eat ice cream, and I'm very thankful because I don't feel like I'm different. You know, diabetes, I don't think it's a management, you know, and actually it helps us to live life much healthier, you know, like as long as we control our blood sugar well, I mean, you know, there will be no problem and no complication, right? So I think that's another positive point as well. Of course, there was a lot of hard time for me as well, you know, like at the teenage life, you know, I want to go out and hang out with my friend and eat, you know, whatever I want, but I couldn't do that. And, you know, every time I come home, I have to go and do exercise. So I still remember like, it was like snowing so hard, and me and my dad, we went to the park and we were playing badminton. I'm like, oh, it's snowing, I'm so cold. But he's like, no, we have to like play 30 minutes. And when it was raining, we went to underground parking, and then we're still playing badminton. And now thinking back, like that was so bad. Like, you know, there's like car coming in, and, you know, not much ventilation. So it was very bad, but I don't know, somehow we made it. So, but I at the beginning, I hated it. Like, I don't want to go out and do exercise and stuff. So that was hard part. And my mom, I remember, so she made like a tofu soup, and, you know, tofu usually it has a lower calorie. So in order to, you know, like fit my, you know, I have to, you know, say I'm given like 500 calories for lunch. So in order to like fit that, like she has to make a lot of tofu soup, and she's like, you eat it. And at that time, I was like I didn't feel it. I felt like I was throwing up. And then my mom got so upset. You put, you know, you inject just now. If you don't eat everything, then your blood sugar will go down. I'm like, oh crap, you know, like, but like I cry, and then so I ended up not eating. But I don't think my blood sugar went low because I was already having like a lot of nauseous feeling. So that was kind of hard part, you know, that like sometimes I have to like, you know, like eat even though like, you know, I don't want to. But I think for my journey, you know, like it sucks. You know, we don't have any vacation. There's no such thing as like diabetes vacation. I always have to be very sharp, and like it live by myself. So sometimes I was talking to my nurse, you know, if I have low blood sugar and if I'm not being able to wake up in the morning, you know, like because of the low, like that's really scary part. But my nurse was like, I'm very thankful. I have a really great diabetic team that I work with. I usually like check in with a nurse, like, you know, like every 2 months, and I have a great endo as well. So I'm very thankful. But she was telling me, you know, like, do you feel you're low? And I said, yes. Then, you know, you should not worry about being low at nighttime. You know, you will wake up. So it kind of gave me like assurance. So, I mean, I didn't have any like bad lows or anything that I wasn't able to wake up in the morning. So, you know, just get along with it. And yeah, it's just, I mean, diabetes is just managing well. And yeah, and hopefully there will be a cure. Well, right now, there's no cure, or not cure is not readily available. You know, it's not like you inject and, you know, diabetes will go away, right? But it's, you know, until the cure comes out, you know, I'm ready to, you know, fight, I guess. Yeah, you know, keep walking forward. So yeah, that's my story. Thank you.
Thanks, June. You know, two things that I heard is, one, that it's so amazing how you pulled good things out of it. So you're saying, okay, before you didn't exercise at all, you're maybe like a slug at home, and you think of it as it pushed me into being more active, but also it pushed your whole family to change. And all the changes they made were obviously for the better in terms of their lifestyle habits. It does sound like you have a great team around you in your home, but also a great team around you in just the healthcare setting. So, you're very lucky. You're very, very lucky, because I feel like I hear more stories where people don't have that. They may not have family around who are close by, or they don't have the best endo. So you should be feel very fortunate. I want to just mention we're at 7:30, and I want to kind of put a plug in for next month's huddle. And this actually isn't for you, it's for the caregivers. So it's for your spouses, your parents, the people who love you, the people who are affected by you, if you have a low, if you're high, if you forgot to bring your glucose tablets and you're going on a plane. So we're gonna go ahead and email you, but if you can email or forward the email to your partners, your loved ones, it's going to be a session for them. And Lauren Moore, as you can see her on the screen, is a counselor as well, and some counseling, and master's in counseling, and she's going to be co-leading the session with me. So I think it's going to be a great session. And I apologize, but you guys aren't invited, because we want your we want your loved ones to be honest, to feel free to be angry, be sad, be frustrated, and not feel guilty that they're going to make you feel sad. So again, and Dave, you had mentioned this too, that your wife was asking, when are you going to have a caregiver session? So this is it. Next month, it's going to be September 23rd and 6 o'clock, but we'll give you all that information. The next thing I wanted to just announce is, and I'll probably email you guys about this, but Dexcom has invited me to give a talk to extended healthcare companies and employers to talk about diabetes and mental health, with the goal of, why should we cover CGM? What's the benefit for the employers? What's the benefit for insurance companies? And so obviously there's the business case, but I'm going to ask everyone to send me your thoughts about what would you like health insurance companies, extended healthcare companies, and employers to know. Like, why is it so important that they need to cover our CGM? They need to just have better coverage for diabetes supplies, because that is what I'm going to use in my talk to bring in the patient side in addition to the hard data, because I think you need both to essentially have a compelling argument to push people in the right direction. So thanks everyone. Thank you for coming, and we will see you next month. Bye-bye.